Today, we're going to talk about something really important: decoding the secret language of your own body. See, your body is sending you signals every single day. Most are pretty subtle, but some are critical warnings. We're going to break down 10 of them that could literally save your life. You know, this isn't just some feel-good quote. It's a biological fact. From your heart rate to a sudden headache, your body is always giving you a status update. The real trick is knowing how to listen. And that's the real question, isn't it? In our crazy, busy lives, it's just so easy to ignore those little whispers. You know, the small aches, or that feeling that something is just a little bit off. We just dismiss them, we push through, and we start to think they're normal.
And that's exactly why we're talking about this. Learning to hear these signals is one of the most powerful things you can do for your health. Believe me, doctors take these signs very seriously, and by the end of this, you will too.
So here's the plan. We'll start with those quiet whispers your body sends out. Then, we'll move on to the loud alarms that mean you need to act fast. We'll wrap up with the nagging signals you really shouldn't have to live with, and tie it all together with one key idea.
All right, let's dive into the silent warnings. These are the tricky ones, right? Because they often just feel like a normal part of life. They're the whispers that come long before the scream.
We all get tired, of course, but this is different. This is that deep, bone-tired exhaustion that just doesn't go away, even if you're getting a solid 7 or 8 hours of sleep. It's waking up and already feeling completely drained.
And look, this isn't about being lazy or just needing another cup of coffee. Your body could be signaling something much, much deeper. For instance, if your heart isn't pumping the way it should, your body gets less oxygen, and boom, fatigue. This isn't a weakness, it's a clue.
Now, this one might sound like a dream come true to some people, but trust me, losing weight without even trying is a major red flag for doctors. We're not talking about a pound or 2 here and there. This is a big, unintentional change.
So, what's the number to watch for? Well, doctors start to get concerned when you lose more than 5% of your body weight in just a few months, for no good reason. So for someone who weighs 180 pounds, that's a 9-pound drop. That's the point where you should probably check in with a doctor.
Yeah, the potential causes here are pretty serious. Things like an overactive thyroid can basically kick your metabolism into overdrive, just burning through calories. Just remember, weight loss is only a good thing when it's on your terms, when it's healthy and intentional.
Your skin is your body's largest organ, and it's an incredible window into what's happening on the inside. So any weird changes in its color or texture, well, they're often way more than skin deep. They're direct clues from your body. So let's break down how to read these clues. If you notice your skin or eyes looking yellowish, that's called jaundice, it could point to liver trouble. Really pale skin can be a sign of anemia. A bluish tint on your lips or nails means a lack of oxygen. And those dark, almost velvety patches of skin, that can be an early warning sign of insulin resistance.
Okay, we've talked about the whispers, now we're moving on to the screams. These are the sudden alarms, the signs that your body is in a crisis and you need to take immediate action.
This is the one a lot of us know about, but we often misunderstand it. Let me be really clear. Any chest pain or pressure is an emergency until a doctor says it's not, period. This is not the time to be tough or wait it out.
You know, we all have that image from the movies of someone dramatically clutching their chest. But in real life, a heart attack can feel totally different. It might be a tightness or a pressure, like an elephant is sitting on your chest, or even a burning feeling. And what's really crucial to know is that women, especially, often have different symptoms, like nausea, crazy fatigue, or shortness of breath.
Look, feeling a little lightheaded once in a blue moon can happen to anyone, but frequent dizziness or actually fainting, that's a huge deal. It's a direct signal that your brain might not be getting enough blood or oxygen, even if it's just for a second.
So what's behind it? Well, it could be something as simple as dehydration, but it could also be a sign of low blood pressure, an irregular heartbeat, or even problems with the circulation going to your brain. Don't just brush off feeling dizzy all the time. Getting winded after climbing a bunch of stairs? Totally normal. But feeling like you can't catch your breath while you're just sitting on the couch or talking or trying to sleep? That is a very, very serious warning sign. If you're breathless when you're not doing anything, it means your body is really struggling to get the oxygen it needs. This is an emergency. It could be a sign of anything from heart failure or lung disease to a blood clot or severe anemia.
Okay, this is one of the classic signs of a stroke, and for a very good reason. If you suddenly feel numb or weak, especially if it's only on one side of your body, it could mean the blood flow to your brain is blocked.
And in this situation, every single minute counts. The best way to remember the signs is the acronym FAST. F is for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one arm drift down? S is for speech. Is their speech all slurred or strange? And T is for time. If you see any of these signs, it is time to call for help immediately.
All right, finally, let's talk about the persistent signals. These are those nagging symptoms that just hang around. We often learn to just live with them, but we really shouldn't. They're chronic warnings that something isn't right.
I know, it's not a fun topic to talk about, but it is so incredibly important. Your digestion tells a story about your health. Any big, lasting change that goes on for more than a couple of weeks really does deserve a conversation with your doctor.
So what should you look for? Well, red flags include things like blood in your stool, constant diarrhea or constipation, or really dark, black stools. These could signal anything from an infection to more serious conditions like inflammatory bowel disease or even colon cancer.
Most of us get headaches, but a headache that feels different or super severe or just won't go away, that is not normal. A headache that's so bad it actually wakes you up from sleep is a particularly dangerous sign.
You need to pay attention if your headache gets worse over time, or if it comes along with other things like vision changes, vomiting, or confusion. These aren't just headaches. They could be signs of dangerously high blood pressure or a serious stroke risk.
And finally, number 10, pain. Specifically, pain that doesn't have an obvious cause, like an injury, and just won't go away. It is so easy to write this off as, oh, I'm just getting older. But that's not normal. Chronic pain is your body's alarm system, and it's stuck in the on position.
So what's the big takeaway from all this? It's actually pretty simple. Your body is an amazing communicator. It gives you warnings, it gives you clues, and it never, ever lies.
I think this phrase just says it all, doesn't it? Your body warns you before it breaks down. The whole key is to listen to the whispers, that constant fatigue, that nagging pain, those subtle changes, so you never have to hear the scream.
So I'll just leave you with this question. Take a second, right now, check in with yourself, and just ask, what is my body trying to tell me today? Because listening, that's the first and most powerful step you can take. Thanks for tuning in.